So with that thought of patients bringing information to their doctors, it almost feels like there are two different camps, right? There's the camp of like, don't go on WebMD or Google and look up things, and I think that people sometimes might feel like they're telling their doctor what to do, but then there's also the thin line of saying, hey, like, is this an option for me, or is this a good option? How do doctors typically react, and what should patients expect? Is there a way that they should ask the question or present the information to get the best?
So you're right. It's a slippery slope, right? Because I can fondly remember you going to your patients and they're Googling everything, and some of it is not um, good information, and it's all about, oh, you're taking um, this medication and this is supposed to help cure the disease, or you're going to take all these different supplements and this is supposed to cure the disease. So I think there's good information and there's misinformation, right? And so I am a big proponent of you doing your own research and bringing it to your doctor, and your doctor should be receptive and being understanding for you so that you can learn, right? Um, Come to your doctor with all of the literature, and so that your doctor should be able to address it. And there's many things that we may not know, but we have the resources, and we also can phone a friend as well, to say, hey, is this patient a good candidate for a clinical trial? What do you think about this? I have called many times, some of my good friends, and said, hey, I think a patient might be a good candidate for a clinical trial. Do you have any options for them? So yeah, that never feel like you're afraid or you're being too cumbersome for your physician.
Mm.
It's your job. This is your own body.
And in just thinking from the physician perspective, as you see people in practice, I mean, life is busy. There are lots of patients, there are insurance questions, there are lots of papers being published, it seems that all the time. Um, what, from your perspective, can physicians do to maybe handle those types of suggestions and navigate those conversations with patients better?
It is hard, being a physician, and it's definitely a hard time in the cancer era, for being a physician, because it's just multitudes of information being thrown at you, and numerous conferences that you're expected to go to, numerous data, numerous game changing things, and so I think, you just have to be receptive. And if you don't know at that present time, for your provider, it's okay to say, hey, let me get back to you. I think with the time constraints of seeing all of these patients, you can't answer everything in that instance. I mean, that's impossible.
Mhm.
But being able to say, hey, I may not know that information now. Let me phone a friend. Let me get back to you. Let me see what new data there is. And I'll get back to you at your next visit, or I'll give you a phone call. That's okay too.